More Than a Mother indicates that women are more than mothers. The campaign is to empower infertile women and women who fail to have children through access to information, health, change of mindsets and culture, and empowering them economically and socially. 50% of the causes of infertility due to male factors, but men mostly does not want to admit or even go to test for infertility. We want to raise awareness about this. We encourage them to speak up and encourage them to discuss it openly and take team approach of family building in Africa and today in Nigeria.
The Senate is very happy to partner with Merck to launch this initiative, Merck More Than a Mother campaign today in Lagos. The Senate, represented by the Senate Committee on Health, together with the wife of the President of Nigeria, will take this forward to make a change in the culture in the perception of individuals having challenges on infertility. Also, we'll have assisted reproductive technology policies that as a Senate we will introduce to empower infertile women socially and economically through improving access to information, health, and change of mindset in Nigeria.
As members of parliament and leaders in every platform that we have to make sure that we use that platform to change policies, to create awareness, to educate the community. As Senator Landry stated, that most of the cases can be prevented. But how can they be prevented if we don't give out that information? If we don't reach out to the community that are suffering from this and they don't know what to do? They need to know that there is an alternative. They need to know that there is treatment. They need to know that there is early detection, prevention, and cure before you get to a point where it becomes like impossible or very expensive for you to get a child.
In introducing this policy in the Senate or House of Representatives, all the messages we are going to give is going to lead towards more advocacy, making more noise about why infertility is not a curse. And also, there's a lot of noise about sexual education in schools today. So talking about the sexually transmitted diseases that could lead to infertility definitely is an added message that must now be emphasized. And I believe that with Merck More Than a Mother campaign and all these added messages to it, it will also do Nigeria a lot of good.
How are you? So I will ask her a question. I know that you suffered a lot during your history and journey with infertility. But I want to tell us, what did you face with infertility and what is your situation now? Are you happier?
Yanzu zaki gaya mana wahalan da kin sha da don infertility da shike baki da yaro, da kuma wahalan zaki express yanda ya dame ki, da kuma yanzu kina jin daɗi da abin da Merck sun miki, ya ne kina ji a jikinki yanzu?
Wahalan da na sha lokacin da bani da yaro da ina zama da mai gidana ba komai da yake tafiya, ina sananin wahala, masanaciyar wahala, ba na samun ci, ba na samun sha, ba kwanciyar rai.
Okay, when she was with her husband, because of the fertility, there was no peace of mind. She was suffering. There was nothing to eat, quarrels here and there. Things were not moving on fine for her.
But what about now, after you have your own business now?
Okay, yanzu da Merck sun bude miki business yanzu da kike yi, ya ne kina ya ji a jikinki?
Oh, ban san abin da zan ce ba.
She doesn't know what to say.
Ina gode ma Merck.
She's needing to thank Merck for what they've done to her. She's really very happy.
You know, in thinking about this, first of all, it's important to realize that the stories that you've heard, we as physicians hear part of that. So we certainly hear the poignant pleas of women and men who wish to have their infertility problems addressed quickly, quietly, secretively, and we hear that. And so how do we respond to that? We respond to that in a scientific and a medical way. Those of us who are in medical schools like Dapo, myself, and others, we do experiments. We devise therapies that we think are effective, ways to diagnosis, ways to understand exactly why these problems have occurred. And if we are successful, we publish these articles in scientific journals. We argue among ourselves about facts that the patients don't understand. Either other people in the highly educated tier with which we deal find boring, they're statistical, they are based upon small methods, and it really doesn't go very far.
A woman's right to have a child is a human right, right? And I think that's a message which we need to help to propagate, so that even in resource-challenged countries like ours, where we should also emphasize that women shouldn't be denied access to health care. Now, when you say denied access to health care, create the awareness that, yes, they have a problem, they've been married for 1 year, you don't have a child, but where do they go? Are the facilities available? You see, we need to create the facilities at the same time as creating the awareness.
Merck supports this program, and we believe it is adding value to the whole value chain, because you cannot be in the pharmaceutical industry without engaging with patients. Whatever we do every day, being in research, being in development, being in other functions of the company, at the end of the day, we're working for the well-being of the patients. This is what we're here to serve. And such programs demonstrate our commitment to fertility and to societies we operate. 1978, Louise Brown in UK, the first tube baby was born with the help of our company. And of course, esteemed scientists that worked endless hours to develop the technique. And we have, and this is an assisted reproduction technique. So that means you have a lot of people around it. You have physicians, you have embryologists, as you say, you have technical staff, you have a lot of people creating and paving new ways to deliver.